Doing something that maybe couldn't normally be done or nobody has taken an interest at. I like giving back to the ones that nobody wants. Doing something that maybe couldn't normally be done or nobody has taken an interest at. I like giving back to the ones that nobody wants.
Sponsored by
Welcome to Seeing the Need, Finding the Solution. I'm your host, Phil McIlveen. 2012, Where Do We Go From Here campaign, understanding health disparities, understanding how to treat the whole person with a focus on finding the solution and with integrated health solutions. Privilege and an honor to welcome my guest, Mr. Ted Williams, CEO of Arizona Behavioral Health Corporation.
Good morning, Phil.
Welcome, Ted. Ted, a little bit of background. You've been involved in quite a bit for quite a while, so give the viewers a little bit of background about yourself.
Well, in the public sector, the public health sector, I've been the director of the Department of Health Services for many years. I also ran Maricopa County's hospital, clinics, environmental systems for many years. So I spent a lot of time on the public sector. I've also been involved in the private sector, running hospitals also with Baptist hospitals and health systems. So.
Okay, and within that element of the behavioral health system, Arizona Behavioral Health Corporation, there's also a government side of that too, is there not, that you have advocacy and different stuff like that?
Yes, we also run a foundation. There is a foundation for behavioral health, and that is designed to provide advocacy for people in the behavioral health system. We also provide various supplies, what we call startup kits for folks going into housing. And of course, we've also over the years given away over $1 million to various other agencies to look at some systemic change ideas to make the system better.
So you give away have over $1 million. Mm-hmm. You also have needs as well.
That's correct.
So you're in that housing element of being able to house people who need it. People that obviously need housing, they need blankets, they need beds, they need dishes, they need pots, pans, all the stuff that normally we clutter up in our homes and have way too much of, and probably even have extra in our little storage room too. I know I do, so I'll take first accountability of it. Give us a little bit idea about the housing and what that involves in from your angle.
What we actually deal with, we have some 1,600 people in Maricopa County in housing from Apache Junction, well, from Apache Junction all the way to Wickenburg. These are individuals that are homeless, that have been homeless. They are all have a diagnosis of serious mental illness. They're all in the behavioral health delivery system. So these are folks that historically have been very difficult to house. But of course, if they're not housed, they wind up in jail, they wind up in the emergency departments of hospitals, they wind up being victims of other types of you know, assaults and so on. And you know, the fact that we do have success in housing this segment of the behavioral health community has been exceedingly positive, because just think from just a normal medical point of view. If you're diabetic and you're homeless and you're out there at 110-degree temperature, you know, how in the world can you be compliant with meds? And
Sure.
The same is true with behavioral health meds that are quite effective nowadays. If there's no place to actually keep your meds, if there's no safe place to be able to you know, live, to eat, and you're mentally ill at the same time, it's horrific. So people wind up in jail and they wind up in emergency departments of hospitals.
So what happens to the aspect where the person falls short, they wind up in the jail, they get released, say they've fallen out of the system, or maybe they've never been in the system, and say they're seriously mentally ill, and what if they've been denied services? Is there any hope for them in any areas of that?
There is hope. Today, Maricopa County Jail, which is the largest health facility, behavioral health facility in the state. The county jail is the largest mental health facility in the state,
Really?
which is
Wow.
amazing and unfortunate. But there is a very active program to connect folks that have mental health problems with community resources upon leaving. It's not perfect, but it's a long, long way from what it used to be, and that helps people from falling through the cracks and helps people from, you know, winding up coming back again for some infraction. I mean, we're talking about infractions, not just, you know, not stealing, not assaults and battery. We're talking about trespass. You know, people that wind up sleeping in the wrong space or relieving themselves in the wrong place. You know, so a lot of these are very petty things, but they still wind up in the criminal justice system. So they need an attorney. They need a county attorney's office needs to be involved. The judge needs to be involved. The health system. So providing appropriate services reduces all of that otherwise governmental expense.
And we'll be having some legal aspects coming on the show later on during the campaign. But you know, I read a story. I did some research in reference to a gentleman who suffered from serious mental illness, and he was being very loud in a store. And they called the police on him, and he was hugging the ATM machine, and his mother was there. What I'm getting at is he wound up dying inside that incarceration aspect. From different reasons, but what I'm getting at is that element of somebody taking their medication, like you said, having a place for it to store it. I used to do medication observations for an agency I used to work at years ago, and these people counted on that stability to be able to maintain a day or be able to maintain a healthy sort of lifestyle for them as well. So you guys are in it all in reference to that aspect. I mean, if somebody isn't safe in their housing, that really is the key point of really helping them become a whole person.
Yes, I mean, some will tell you that the loss of your home is tantamount to like a loss in the family. I mean, it's tremendously traumatic. And of course, if you already have a mental health disability, it just exacerbates it. So.
Wow. Okay, let's talk about the information systems a little bit. Information systems when it applies to mentally ill on your end.
Well, what we're interested in, many years ago, our agency partnered with Jewish Family and Children's Services to actually start building a more sophisticated information system for people in the behavioral health system. And there are a myriad of different products and systems out there, and of course some are quite primitive and some are getting to be more sophisticated. And while it has worked, what we're seeing is the transition to an integrated behavioral health system, integrated with normal acute care, where you'd have a PCP or a primary care physician along with the mental health services. Well, the two systems don't tie together nicely from an electronic medical record point of view, from just a coordination of care point of view. So we have a couple of challenges. One challenge, of course, is for the behavioral health system in Maricopa County to actually be able to tie together better within its own sphere of service delivery, and then, of course, to be able to deal with the upcoming transition to an integrated service delivery with the acute care and behavioral health. And while I mean, it's almost as hard to say as it is to do, nowadays, if you go to a PCP, a primary care physician, and your physician thinks you have some type of heart problem, they'll refer you to a cardiologist. And hopefully there's an interaction between your physician and the cardiologist, and they feed back information and so on. Right. We don't have quite that level of interaction when someone hits the system in behavioral health. They may wind up in an emergency department, they may wind up in jail, they may wind up in a crisis system. They may be initially seen and a plan actually developed for them, and they may be referred to another agency and another agency to specialize precisely in what they're dealing with. It may be a combination of substance abuse and mental health. But in order to treat the whole person, we have a data system, or a lack of a data system, to actually ensure that there is a good coordination of care. The world is changing. The world is changing because of some national health care insurance, but in Arizona, it's changing even before that, because in this year, the Department of Health Services, the Access, our Medicaid agency, are working together to create a delivery system in Maricopa County that will, in fact, coordinate, integrate the acute medical care with behavioral health care. So we treat the whole person. And that is awesome. A quantum leap from where we've been. We're talking about a lot of money. We're probably talking about a contract that'll run over $1 billion a year, and it'll treat a lot of folks. But the idea is, if you have all that money and you have all that need, the question is, how can you do it most efficiently? How can you also ensure that you're providing the best care?
And, you know, with that, we're going to go to commercial break in just a couple seconds here. But, you know, I thought when you said about that $1 billion, $50 billion was spent on the Super Bowl. Be quiet and give it back. We got some room for it. Be back after the commercials.
Spend all your time waiting for that second chance, for a break that would make it okay.
We are 100% committed to preventing suicide.
To feel not good enough.
We represent 100%.
We represent 100%.
We represent 100%.
We represent 100%.
There's no stigma or discrimination against the heart, the liver, the kidney, even the gallbladder. Doesn't even have a job.
Yesterday, depression was kept in the dark.
And bipolar disorder was your best friend's mother's problem.
But the tide is turning.
We're stopping the stigma.
We're coming out.
Our goal is to make the discussion of mental dis-ease cool and trendy.
No kidding?
Me too.
No kidding.
Me too. No kidding.
Me too.
It's time we gave the all-American brain some peace of mind.
Living with mental illness is a challenge, but it makes me stronger.
Some would say I'm crazy. I would say I'm enlightened.
Some would say I have a disability. I would say I have special abilities.
Some would say I'm far from ordinary, but I'd say I'm extraordinary.
1 in 4 adults are affected by a mental illness.
To learn more, visit 1in4.info.
I'm Jeremiah. I work at Chrissy Ski and Board in Lakeside, Arizona. They're very convenient, small cars. They get the job done.
Well, I always go skiing, but I didn't have something like this. Convenience, speed.
You have your kids in the back, right? But you're still able to carry your skis, carry your board, whatever you want, while still having your kids in the back. Get it. It gets the job done.
Absolute Computers, building networks and community business relations with technology of on-site repair and support by providing reliable, better networking and business solutions. Located at 9210 West Peoria. Absolute Computers. Visit absolutecentral.com.
Hi, welcome back to Seeing the Need, Finding the Solution. We are here with Ted Williams, Mr. Ted Williams, CEO of Arizona Behavioral Health Corporation, and we started talking about information systems and integrating the two parts of that mental illness type aspect with the primary care and the mental health care, and you know, a lot of HIPAA guidelines and a lot of different aspects, I'm sure, to all that kind of stuff. And we left off with you know, amount of money, $1 billion type of deal, and I said something about the Super Bowl costing $50 billion as well. And the reality of it is there is a lot of funds out there spent in the wrong ways, in my opinion, and hopefully I can find a way to bring some of those back and get a way to take this city, and might as well bless the city if we're going to live in it. Ted, some of the stuff you guys do is tenant-based rental assistance, permanent housing for persons with HIV and AIDS, permanent housing for persons with a serious mental illness, shelter programs, transitional housing, and you contract with a number of different agencies as well to provide stuff too, is that correct?
We do. We contract with basically 3 agencies, but we coordinate with all of the folks who provide delivery services, because our folks are in care. They're not just in a residential setting. They actually are getting care to be maintained and be able to function in the community. And it's obvious, we can demonstrate that their recidivism going into the jail system, their recidivism going into the emergency departments drops off dramatically.
Absolutely, and especially with those people, it's not just housing, it's when they are placed in housing, and then there's different programs within that aspect, the services that are provided, like medication observation, group, transportation, social activities, and providing these people with a quality of life that goes along with that as well. And kudos, because that's not an easy business to be in as well, and in reference to that adult side of it, and being able to not only obtain the housing to be able to put them in there, but as well providing those services that are so needed for them, from simple hygiene all the way up to you know, employment, if that's the case, or even making some of their dreams come fulfilled. You're talking about information systems, and I was talking with Tomas from People of Color Network, and we were talking about different stuff about buildings and different just different stuff, and transferring data. I remember when the Magellan and Value Options switched, and all that stuff got cut in that one year, and meaning had to switch systems and stuff. And with the information and the computer stuff, I'm going to lead into our next guest, then come back to you. Robert Crossland, owner from Absolute Computer Technologies. Hi. Welcome, Robert.
Thank you.
How important is it for organizations when they say they're acquiring a new business, or they're trying to merge something as big as that type of data that goes along with restrictions that you also have to follow on a federal level, correct, Ted?
That's correct.
Sure.
Well, give me some feedback.
Well, I mean, the installation that you're going to be hosting the other location, we go through the requirements for the power for the computers and servers, and to mesh all the equipment and make sure that the proposed location is of good use for the client. But some of the aspects you have to look at are like server integration. I mean, communication with the headquarters, for instance, whether you're moving from a metropolitan area from one side of the city to another, or going from state to state, we have to provide the ability to connect the communications so that the whole network gets together. And so the stages that we go through are inspection of the building, from moving of the equipment and making sure all the power requirements and the data lines are secure and available, to even service after the sale, which is to help with the ongoing services to make sure backups are being done and making sure that their data infrastructure is secured and available from anywhere in the world.
And I did that to off track the phone that just rang, which was mine. I'll take ownership.
Okay.
Just kidding. It's yours. When we're talking about somebody acquiring a new business, which means that business is no longer going to exist in the place that it's at, and then it's going to be, say, moved to Arizona.
Okay.
Or we're talking about taking a whole system, like Ted was talking about, from a PCP or primary care provider standpoint with the mental health and merging it. I really didn't think about you had to look at your building and structure and power and all that kind of stuff, but when it comes to data systems and developing something that's going to, I guess, commingle, shake hands correctly, what's that process like? Have you ever dealt with two different systems trying to come through?
Sure. A lot of it has to do with different types of database structures. Typically, companies utilize a common platform like SQL or so, which means they're using a common platform that houses all the information and all. When you mesh two types of environments or software together, you might have to undergo moving or migrating data from one portion to another so that the system can be complete and work as one. So you might have two distinctly different software programs that mesh together to provide like a global care or something that gives you one platform that everyone gets utilized after that. That happens during acquisitions of companies from other departments or just all out combining resources.
So Ted, on your end, and you, like I said, you have definitely a lot of experience. Well, that's probably the most important part. When you're trying to merge those two aspects together, of the mental health side and the physical health side, what are some of the challenges you guys have come across in reference to that?
Well, we're actually looking at trying to merge the operations from a patient record point of view of about 90 different agencies. So it's a bit of a Herculean task, but we're looking at building what's called an HIE, a Health Information Exchange. These have been in place in Arizona already. I mean, some of the larger hospital systems are using them. One would hope that there'll be a statewide HIE, but they're also specialized. And what we hope to do is to provide that type of conductivity, that type of electrical medical record, the computerized medical record that's available so a person can be tracked. So you can also check the labs, you can check the hospital utilization. You can even check whether or not they're in and out of the criminal justice system. So when treatment is being provided in one part of the delivery system, that can be built on and coordinated instead of people starting or an agency starting from ground zero. And that's just the behavioral health side. The reality of life is, and then you add to that the acute care, the medical side of the delivery system. So we know who's on insulin, who has high blood pressure, and so the whole person can be treated. Today, we're getting better, but in some cases, information's being faxed. In some cases, it's electronically being moved. But there isn't a common way for the system that's all funded the same way. I mean, that is a common fund source, but the distribution of how the service is provided can be quite different. So we really need to bring that under one system of care so it can be coordinated.
And what an eloquent way, one difference between me and most of my guests, what an eloquent way to say it. Everybody's not working together. I mean, the reality of it is you take somebody like People of Color Network, somebody like yourself, Magellan, Impact Suicide, your neighborhood health care center, all these different people and for-profits and Room Store and Walgreens and all these people that are jumping up to the table on things and trying to make a difference and say, hey, let's work together as a team. And that's really integrated health. It's about pulling all those elements together. And how I can't help but the stigma of what it's like trying to get different hospitals and physicians. And I thank God there are some people on board and people that are willing to jump out there. But how many people are afraid to jump in that because of what they're used to and being in the same thing, repetition thing over and over and over and over again. It's amazing how much it's needed, how it's funded the same way, but at the same time, how hard it is to get it complete. And you've been dealing with, what is, in reference to, is there, if there was one stigma you could, or a couple that you could put your finger on in reference to getting this done that would help this, maybe get it really kicked, what would it be?
Well, of course, education helps reduce stigma. I mean, you know, something is the race for the cure for breast cancer. Years ago, women were unwilling to talk about that. You know, HIV, I mean, again, people were unwilling to talk about that. But what happened is that you couldn't address the disease because people would not come out and learn and identify themselves as folks where you actually could control it. The same is true with mental health. I mean, people still are unwilling to talk about family members, whether they think it's hereditary or whether they just are ashamed. A mental health condition is just it's your body. It's like a liver condition or a broken leg. I mean, we need to think of the whole body. You know, we've come a long, long way in providing services to people with mental health disabilities. And we can do things today that weren't even dreamed of, as far as balancing the chemical imbalance in the brain, for instance. So there's been a lot of progress, and there's going to be more. But in order for a person to actually be treated, they need to actually have support of their family. They need to understand what's going on, and they need to be in a system that supports that recovery.
And you know, I love the public service announcement that talks about "No kidding, me too," and one of the phrases is that we're stopping the stigma. We're coming out, and the reality of it is trying to get mental illness to be cool and trendy, and give the brain some peace of mind. And that's what we're doing as a whole, and a lot of us. We're coming out. We're coming out to Phoenix, we're coming out to Arizona, reaching out to different states and pulling it back here to try to make a difference. Aligning computer companies as well onto the team to give advice and give wisdom. Aligning different product companies as well. Campbell's I was talking about, put that pink ribbon on that can when you're talking about those stigmas. And $250,000 for first 30 days, second 30 days, doubled it. $500,000 in free media. And you know, you've seen pink around for a long, long time. And mental illness has kind of been the silent giant. For quite a while, and it's time to step up, let it out there, and Arizona is one of the leading places where the stats are a lot higher, as well as health disparities among the people with mental illness. Ted, you will definitely have you back on the show from Arizona Behavioral Health Corporation. I want to thank you very much for coming on.
Thank you for the opportunity.
Robert Crossland, Absolute Computers. This isn't your first rodeo on here. You'll be back on as well. And to the viewers out there, log on to aztv.com or Arizona Midday as well. Go to stnaz.tv and you'll see a little bit of more information on what we're going. Go to peopleofcolornetwork.com. You can go to azabc.org, absolutecomputers.com, and a whole bunch of other stuff. We're coming after you. See you next Sunday.